Hi, Dr. Harris.
Hi.
Thanks for helping us out today.
Hey, you're welcome.
We're gonna start with just kind of asking some questions about what's been going on with your back and some of the stuff going on down into your leg.
Okay.
So why don't you just kind of tell me a little bit about what's going on?
Okay, great. So this has been going on for about a year now.
Okay, so like last June.
Last June, yeah.
Okay.
Yep. So the past several years, I've been very active in terms of hot yoga,
Good.
like daily almost. It's just been very good for my life in general.
Good.
But in June, I went back to Orange Theory.
Okay.
To just balance everything out a little bit better.
Get a little stronger.
Yeah.
Yeah.
And I would say, I think it was probably like the second or third class that I had taken in June. It was what they call like a power day.
Okay.
So it was a lot of like big ranges of motion with load.
So like med ball slams,
Yeah.
kettlebell swings,
Like overhead snatches,
Okay.
like using the ab dolly and doing like V-ups,
okay.
things like that.
Yep.
There's a lot of that. There's a lot of sprint rowing and a lot of sprints like on the treadmill.
Okay.
I remember at the end of the class, I felt like a little sore, like right in my low back.
Like pretty central.
Pretty central, pretty
Okay.
low. And then the next day I woke up and I was just like super stiff, just in general, all across my low back. And then I had just like a faint, I don't even know if I would call it a pain, just like a discomfort. Like
Okay.
Very faint along the outside of my leg and
Okay.
into my foot.
Okay. Let me tilt this down so they can see where you point at your foot.
So it was like outside of the leg and then like into the side of my foot.
Okay.
Came to school, had you needle me.
Yep, I remember that. It was pretty tight.
Yeah, very tight, but I
Yep.
felt better. Within like 2 days, it went
That's
away. No issues.
Really good. And
So-
you were doing yoga still. and-
Yep, still doing yoga,
Okay.
still going to Orange Theory. And you know, it was just one of those cycle things where like every other week at Orange Theory, my back would just get a little stiff and sore the next day.
Okay.
I got COVID in August, got pretty sick, was out of commission for like the whole month.
Okay.
And then when I went back,
And did your back feel better? You remember if you had any back pain during that time?
I don't believe so, because
Okay.
I was still trying to do as much walking outside in the morning and at night as I could.
Yeah.
And I remember feeling fine, but I was so distracted by everything else
Yeah.
too. It's like really hard to say.
Yeah.
But
Well, you don't remember noticing it.
yeah,
so that's good.
it definitely didn't limit anything that was already being limited.
Good. Good.
Came out of quarantine, like September, October, got back to Orange Theory, got back to yoga.
Good.
And it was just the same old story, you know,
Okay.
every other week, you know,
So
things
it's
would
still
flare up.
there,
Yeah.
lingering.
Yeah.
And then same kind of still having splotchy stuff at that time.
No leg pain.
No,
It was all
okay.
just kind of lower back
Good.
at that time.
Okay.
In the fall, my travel schedule got very busy. I
Yeah.
was out of town like every other week. And so it would be a lot of like sitting and not exercising while I was traveling. And then I would come back and try to overcompensate.
Okay. Yeah.
So like every day doing a high intensity something, whether it's hot yoga, Orange Theory, twice in one day,
Yeah.
just to try to make up time.
Okay.
So it was still the same cycle of
Yeah.
things. And I would say the intensity of the low back pain progressed during that
Kind of
time.
started to increase. Okay.
Yeah. So I found that I was actually starting to like change what I was doing during the day and
Okay.
just to try to manage it on my own. And then like around Halloween, maybe a little after, one morning I woke up and my back just felt so super stiff.
Okay.
So I got on the floor and tried to like self-manip.
Okay.
My whole back spasmed up when I manipped. I don't even remember which side.
Didn't matter.
When I attempted.
Yeah.
Was not successful. So
Good clarifying.
Yeah, it was not successful.
Okay.
So, you know, my dogs are wigging out because I'm on the ground. So I was
Yeah.
like, I got to get off the ground.
Yeah.
So, you know, I came to my knees. Things got worse. Dogs are still freaking out. So I was like, all right, let me just like climb the wall up.
Yep.
As soon as I stood up, I got this really intense, like 10 out of 10 sharp shooting pain down the front of my legs.
Wow. Okay.
And then I don't remember what happened because I passed out.
Wow. Okay.
So-
Your body shut you down.
It shut me down.
Okay.
But not for a very long period of time. I came to like pretty much as soon as I hit the floor.
Okay.
I hurt my foot in the process. I didn't really see anybody for it. I just
Okay.
kind of self-diagnosed. It's,
Fine.
you know,
Toes are toes.
Toes are toes.
Yeah.
They might have been broken. Not really sure. Not an issue now. Not
Okay.
concerned.
Good. Good. We're healed from our possible toe fractures.
Yes.
Okay.
Yes.
So
Let-
when that happened, it kind of went away, I think, right?
Yeah.
So,
Yep. Leg pain went away within like an hour.
okay.
And then it was just one of those things where I think at that point I was just afraid to aggravate it. So
Yeah.
I was walking and doing what I needed to do, but I wasn't doing any like big motions or exercising or anything like that.
At that time, did you have any numbness and tingling like in that kind of saddle area at all?
No, but I would say like the pain was very frightening.
Was it?
You know,
Okay.
like it was pretty alarming, and I was, you know, not sure if that was the beginning of like something more serious or not. But nothing ever progressed from that.
And no bladder changes.
No bladder or bowel changes.
Okay.
My legs don't feel weak.
Good. Okay.
So that's good. But I would say after that, I just had this intense like tightness, kind of. I'll just get out and show you.
Yep.
Like in the middle of my back,
Okay.
like almost into my sacrum, and then kind of off to the right side.
Okay.
And
so
then,
it's pretty low.
Yeah, it's like low lumbar, high sacrum, I would say.
And then rolls out this way.
Yeah.
And what does that pain feel like?
It's definitely a very intense stiffness, and then I would say like an aching sensation.
Yeah. Almost like you have a toothache a little bit.
A little bit, yeah.
Okay. Does it throb, that kind of thing at all, or?
I wouldn't say that it throbs, but it does feel like the beginnings of a spasm.
Okay.
Almost. And that's pretty much all the time. It's worse in the morning when I first get up, and then once I kind of feed the dogs and get myself moving, it's more manageable.
Okay. So in the morning you wake up, this is current.
Yeah.
And what would you rate that pain, 0 to 10? That kind of central and out to the right.
It's like a 6.5, I would say.
Okay. And then once you get moving,
I would say it stays about a 3 to a 4 throughout the day.
Okay. And in the last week, what has been the highest that your pain's gotten?
Probably the 6.5 in the morning.
Okay, so you don't really go above that anymore, but it's there. Okay, and so in the morning when you wake up, do you feel that leg?
Not at first.
Okay.
Yeah, so I never have leg pain, like even laying in bed. Like when I first wake up in the morning, I never do. I usually sleep. I flip from side to side and then sleep on my stomach.
Okay.
And a stomach sleeping definitely feels the best from a leg perspective. My back just doesn't really care what position I'm in.
Okay.
If anything, probably left side lying feels the best as far as my back. Yeah.
Yep. Okay.
But I would say within sitting for like 15 to 20 minutes, all of my leg pain comes on.
So we've been sitting now for a while. Is it starting to come on?
Yeah, yep. I would say it's most prominent. I feel it a little bit in my right glute.
Okay.
And then I feel it a lot in the outer part of my hamstring.
Okay.
And then like kind of outside of the lateral calf, and then like burning anterior like tib almost and top of the foot.
Okay. And then what do you do to make it feel better?
So standing, like in class, for example, if I've been on my desk and then I go into class to help teach, I would say within 10 minutes I'm not thinking about my leg anymore.
Good. So it helps quite a bit.
It helps quite a bit. It still lingers a little bit, but if I go and like do 2 laps around the building and stand, then it's virtually gone.
Great. So walking, standing definitely helps. Okay, good.
Yep. As far as the back, really, I would say once I calm it down in the morning by moving around, it doesn't change.
Okay. Kind of stays at that 3.
Yeah.
Hovers around there.
Yep.
And this has been kind of hovering now for a long time.
Yeah, I would say since like November.
Okay.
Yeah. So it's like to the point that I've changed how I do things every day.
Okay.
And I would say 3 months ago, I just stopped doing like my normal exercise routine because it just felt like I was circling the drain and I wasn't getting better. So at some point I was like, I've got to change what I'm doing to try to just calm the system down.
Yep.
So I'm not doing any kind of yoga.
Okay.
I'm not doing Orange Theory. I did find this like very I wouldn't even call it beginners Pilates exercise. It's like 0.5 beginners Pilates.
It's like halvesies.
It's like halvesies.
Good.
That I feel better when I do that.
Good. And does it drop below a 3?
My back pain does. Yeah.
Really good.
Yep. So I would say I feel the best after I do that, and I do that probably 3 or 4 times a week.
Awesome.
Just in my garage.
Okay.
I walk the dogs. Feel pretty good with that. I can go for like a very slow jog outside.
Awesome. Okay, good.
And that helps my leg a lot too.
Yeah.
But that's really all I'm doing is baby Pilates.
Okay.
And baby jogging.
Okay. Okay, good. Have you tried lifting again?
No, I haven't. And I'm not. I think there probably is just like a little bit of a nervousness with that.
Yeah, understandable.
Because I'm just not even sure, like I haven't even tried like body weight squatting or lunging, because at this point I'm just so tired of flaring it all up that I'm not sure what would be helpful and what would just continue to hinder the process. So.
Yep. And you've never had anything like this before?
No.
Okay.
You know, like every once in a while, maybe like a little bit of a back pain, but you know, that's kind of normal and part of life, and it always gets better.
Yeah.
You know, so this is completely new to me.
Okay, so let's kind of recap. So currently, when you wake up in the morning, you kind of hover around that 6.5 pain. Once you start moving around, what do we say, like a half an hour?
Yeah, I say within 30 minutes.
Okay, within 30 minutes, feeling better. But your leg stuff can start with any kind of prolonged sitting or that kind of thing.
Yep.
Okay.
Yep.
Been pretty diligent about doing Pilates. How long do you do Pilates for?
So it's like a 30-minute video.
Good.
There's a little bit of like prolonged stretching at the end that I skip though, because I feel like it's just like perpetuate. It's too much neural tension in my leg.
Okay.
So I would say maybe 28 minutes.
Okay, 28 minutes. Okay. But significantly better after you do that. Okay.
Yeah, I definitely feel a lot more functional, in a better mood afterwards, like everything.
Good. And you've been doing that for the last 3 months or so?
Yeah.
Okay. Have you tried another Pilates at all?
Not yet. Like I'm open to doing that because I really would like to get out of my garage and like exercise with people again, or have somewhere to go that's not school and home and clinic. So I'm definitely open to it, but again, just like I think I would just need to prove to myself that it wouldn't flare me up.
Yeah, I mean, I think it's very understandable, you know, especially to the point where you were on the ground, couldn't get up, and it's just scary. And then, you know, leg pain down both sides is just, you know, it is. So, and I get it. We'll work on that for sure. Okay, and so kind of goals for us would be what?
Well, I would like to be able to sit and do my job.
Fair.
So I would. That's probably a big part. But honestly, like, I mean, I'm no Olympic athlete. I'm never going to be an Olympic athlete. But I think I've just passed. I've peaked in my life before this point, so it's fine.
Yes.
But I love yoga. Like, yoga was really very transformative for me from an anxiety and quality of life standpoint. And it, like, I was a dancer through college, so being able to just move my body in that way. Yeah. That's very important to me.
Okay.
And so I think I feel a little bit emotionally just off because I haven't been able to like use that outlet. And the Calm app's great, but it gets really boring after a while.
It totally does.
So I would like to go back to yoga. That's the big thing.
Okay.
And really Orange Theory, like I've just got tired. Like even though I was still participating in it for a long time, I stopped doing the rower completely. Yeah. So it was like I was doing the treadmill, and then I was not even really fully doing the floor program. I was doing a lot of just like planking and static holds, which I think are good for me, but like, you know, when you're not able to like participate like everybody else, it's just kind of a downer. So I would like to get back to those two things, and then just, you know, get back to just my normal daily stuff.
How about have you tested the waters with yoga at all? Like have you done like a little bit, like a 10-minute? Have you tried any downward dogs or upward dog or anything like that?
So I did a little bit of like cobra and upward facing dog. Just, you know, one of the things I noticed that was sleeping on my stomach felt the best for my leg.
Good.
So I did start to incorporate a little bit of that, which I do feel like is a good get out of jail free card for me, in addition to like standing and walking.
Good.
So if like I'm able to do that in a space, I might do like 5 to 10 repetitions.
Good.
But I would say that's as far as I've really nudged the door.
Okay. Is there anything you feel like I haven't asked or that I would need to know?
I don't think so.
Okay. Yeah. I saw on your medical history form some history of a DVT. How I'm assuming that was just kind of a one-time thing?
Yeah, I think so. It was super weird, and like some of the testing was inconclusive, so a lot of it was assumed. So I was on an oral contraceptive for a long time and had been traveling again, but my flight got delayed. We were sat on the runway for a while. It was a really long drive to and from the airport, so I was sitting for probably like 12 hours straight almost. Okay. You know, and I didn't really get up and move around the plane because I was tired. And so I had really bad calf pain after that, and then very severe shortness of breath a few days later, which is how I ended up in the ED. And all of the blood work pointed towards a DVT, but by the time they got me in for imaging, they couldn't find it anywhere. So we're not really 100% sure, but they treated it that way. So I did like anticoagulant therapy for a period of time afterwards, and I'm fine. I haven't had anything since then.
Good. Okay, great.
Yeah.
Okay, well, goals for us, we'll take you through some objective testing, kind of take a look at your back, see what's going on. Just to reiterate, currently, where are we at right now with your back?
I would say back is like 3-4-ish.
Okay.
So central, low, and then kind of right side.
To the right. Okay.
Yep. And then
high butt.
Yep, high butt area. Okay. And then kind of very faint right glute. Okay. Stronger, like maybe like a 3 to 4 outside hamstring.
Okay.
And then same thing, it's like a 3 or 4 toothache lateral.
Okay.
And then burny across the front.
Okay. Okay. Good.
Yep.
Okay, great.
Okay, great.
Hi, Dr. Harris. Okay, Dr. Harris, we're going to just do lumbar, okay? So we're just going to look at your lumbar motion. I'm going to just tuck your shirt back up in here. Maybe for the camera, I might have you face this way.
Sure.
Okay, and then standing here, how are you feeling? Kind of still some of that same stuff into this right side?
Yeah.
Yeah. Definitely a little more guarded down here. Mm-hmm. Yep. And then better as we move up. But on this side, a little more guarding.
Right? Yeah. It feels really tight on the left side too.
Yeah. It would say almost tighter on this left side as we get up to like L1, L2.
Yeah.
Okay.
Yeah.
Good.
And
is this like your normal standing posture you feel like?
This is right here.
Yeah. Yeah. Okay.
When I'm
hanging on those wide ligaments you are.
And I'm not really trying.
Right? Right? Okay. All right. I'm just going to have you bend forward just as far as you can go. Good. How does that feel?
A stretch in the back, right side more than the left, like really low. And then I feel it more in my right leg.
In your right leg, and then kind of like down this part?
Here and across.
Okay.
All the way down.
And then come back up for me. Mm-hmm. And then how does that feel when you come back up?
Back is still sore. I wouldn't say that it's better or worse. It's the same.
Okay.
And then leg, everything below my knee got better, and everything above my knee stayed the same.
Okay, good. And then just kind of give yourself a little bit of support, and then you're just gonna bend backwards for me. Good. How does that feel?
Like pinchy through here.
Pinchy, okay. Yeah. Kind of like right in here.
Yeah, it's definitely more pinchy down here.
And low.
Yeah.
Okay.
Like sharp pinchy.
How does your leg pain do with that?
It's the same. So like below the knee is gone, and then I just feel a little pull like through the hamstring part.
Okay. Okay. What if you kind of give yourself a little bit more support and then bend backwards? Does that pinchy go away at all, or does it?
Yeah, it's a lot better.
Is it better?
Yeah.
Okay, good. And does that do anything to your leg pain?
Yeah, leg's better.
Okay, can you try? Let's try 5 of them. Good. Good. Oh, a little pop there.
Oh, great.
You're welcome, but still do the manip.
4.
Good. Good. And how does that feel now?
It feels better. By the 4th or 5th one, I still felt a little bit of a pinch lower.
Okay.
It wasn't as sharp as it was before.
Okay.
And I would say like my leg definitely feels better, but there's still like a dull ache.
There,
yeah.
Okay. Okay, good. How about with this arm, can you go to the side? Good. How does that feel?
Just a stretch on this side.
That's good motion. You're supposed to get about 30 degrees, so you're doing great with that. Good. How about there?
Just a stretch on this side.
Good. I mean, no really lack of range of motion at this point, so that's a positive. Okay, so they're gonna take this hand and run it down kind of the back of your leg. Good. How does that feel?
Just pinchy. Yeah. Leg is the same though.
And pinchy, like right, kind of in that L5, S1 area.
Yeah.
Okay.
Yep.
Good. And then let's go to the other side. How about there?
Yeah.
Fine.
Maybe like a stretch here, but that's
stretch
fine.
on one side. Okay.
Yeah.
Good. And then, how about can we just watch you do a squat?
Mm-hmm.
Okay. Whoops.
Making a lot of noise here.
How does that feel?
I feel a pull in my back as I go down.
On the right side.
Yeah, well, like in the center and then more on the right, I would say.
Okay.
Yeah.
How about, what if you just do a partial? So like, just go mid. How about right there? Do you still feel that pull?
Not as much. I just feel like I kind of dump like right into here.
Okay.
Like I have a hard time keeping myself tall.
Yep.
Like, and if I try, then it pinches like a little higher up.
Okay. How about, why don't we try that same thing, but now let's like kind of reach down. Good.
That's good.
Is that good?
Yeah, that's better.
Yeah, it looks good.
Yeah.
Yeah. And maybe just right above 90 is where you're gonna stop. Right there.
Mm-hmm.
Perfect. Anything there?
No, I just feel like I can't hold it.
You don't have to. You're doing a great job. Okay. We're gonna try just a forward lunge.
Okay.
Okay. Good. How does that feel?
That's fine.
Good. Nothing?
Yeah, I don't feel anything with that.
Awesome. How about the stuff down your leg?
When I go this leg forward, I feel it a little bit more in my leg
Okay.
versus I don't really feel
Nothing.
anything on this side.
Okay, good. How about can we try a posterior? So kind of reach behind you. Yeah. How does that feel?
Good. Just a really intense pull in my right calf.
In your calf. Okay. We maybe need to get you back to yoga.
I mean, that would be great.
How does that feel?
That's fine.
Okay, can we try that same idea, but now I want to see if you can go back and almost open that hip up a little bit more. Good. How does that feel?
Just pinchy back here.
Pinchy. Okay.
Yeah.
How about that same kind of trick? What if you kind of reach down into the inside?
That's fine. My calf is super tight.
Yeah. No neural stuff, just tight though.
Yeah, maybe a little bit towards the outside of the foot,
Mm-hmm.
but that's it.
Awesome. Okay, good. Let's try the other side. Excellent.
Yeah, that's fine.
It looks really good too. Looks great.
Great.
Yeah, good. How about can you, we're gonna do kind of just a single leg toe raise, okay? I'll be here if you need me. Good. 3, good. 4, now try not to use me. Let's see, 5, 6, 7. Okay, good. Let's try the other side. Good. 3, good. At 5, you don't get to use me anymore. Okay, let's see it. Good. 7, you got it. 8, 9, 10. Okay. Well, we got some things to work on. You're welcome. You're welcome. Okay, good. Anything else in our standing exam?
I don't think so.
Why don't we just, for the sake of our audience, maybe face this way?
Yeah.
And let's just see a single leg stance. Start with this side. Yep. Good. Your posture improved.
I feel like I can go taller.
Uh-huh. Yeah, it looks better. Anything happening?
I feel like a stretch through like kind of posterior chain, like hamstring calf.
Yep.
Into the foot, but that's about it.
Okay. Not your same neural stuff, just more of a stretch.
Yeah, I just feel super tight.
Okay. All right. Now let's try the other side. Good. Better on this side.
Yeah.
Right?
Yeah.
Do you feel that same kind of stretching sensation?
A little bit, but not significant, not compared to this side.
Yep. Really good. 10 more seconds. 8, 7, 6, 5, 4, 3, 2, 1.
Great.
Awesome. That was great. Okay. Come on. Okay, now we're going to move on to our seated exam. We're going to do what's called a neural screen. Before we do that, I just want to check your thoracic spine really quick. Okay. So, hands are going to go lightly around your neck. Elbows are going to come together kind of as tight as you can get them. You're going to tuck your elbows like down towards your belt line and then curve this way. Okay. Anything there?
No, I just feel tight.
Okay. Can we do that? Yeah, I'm going to guide you here. Then I'm going to give you a little bit of overpressure. Good.
Mm-hmm.
So I see a lot of movement down in your low thoracic spine, like nothing really is happening in your mid-thoracic spine. Okay, so elbows are going to come up towards the ceiling. Okay. Ooh. Good. How does that feel?
I feel like I pinch in my lumbar spine when I do that.
Okay, so I'm going to guide you. Okay, so you kind of just let me guide you.
That's tight.
Right? pretty tight thoracic spine. We might need to work on that a little bit. Okay, then you're gonna come here. You're gonna cross this leg over this leg. Good. And then you're gonna rotate towards me. Is that as far as you can go?
I mean, I can go further. Now I feel it in my low back.
You do feel it?
Yeah.
And which side do you feel it on?
I feel it on this side. Like, I was good until I went farther, and then I felt it in my low back.
You felt it. Okay, I'm gonna give you just a little bit of overpressure. Good. Okay, let's switch these guys. Good.
So tight.
Right? Okay, we're definitely gonna work on that T-spine. Okay, now I'm gonna just do some sensation testing. Okay? The goal is you're gonna tell me if you feel the same on both sides. If you don't, if it's diminished or more on one side, then just let me know that. Okay? So what you're gonna do is I'm gonna do it kind of all throughout your leg. Okay, down into your toes. And then I'm gonna just have you close your eyes. Okay? You ready to go? I'm gonna put your hands out here. Good.
Same. 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 Same.
Good. Okay, you can go ahead and open your eyes. Okay, now we're gonna do some muscle kind of testing. Okay? So we're testing the endurance of your muscle. So I'm gonna have you hold for 5 seconds. Okay? With this leg, I'm gonna have you raise your leg up towards me. Good. Hold there. You're not gonna let me push you down. We're gonna hold for 5, 4, 3, 2, 1. Good. That was a lot of effort.
Sweating.
Woo! Okay, this leg, same thing. Good. Hold there. 5, 4, 3, 2, 1. Definitely stronger on this side. Yep. I'm gonna raise our table up just a little bit. You go ahead and sit back. Good. Okay. With this leg, I'm gonna have you kick it out. Good. And hold there. I'm gonna have you bend it just a little bit. Okay. Don't let me push you down. Hold. 5, 4, 3, 2, 1. Okay. A lot of body movement with that one. Let's do this other side. Same. Kick it all the way straight. Good. Bend it a little bit. Hold there. 5, 4, 3, 2, 1. Okay. Good. Now you're not gonna let me pull you out.
Oh, okay.
Okay.
Yeah.
So hold here. Ready? 5, 4, 3, 2, 1. Good. Let's do this side. 5, 4, 3, 2, 1. Good. Okay. You're gonna lift your toes up like that. Good. Don't let me push them down. Hold 5, 4, 3, 2, 1. What's going on up there? Good. Same. Here we go. Ready? 5, 4, 3, 2, 1. Good. Now I'm gonna have you, I'm gonna pull up, so don't let me pull up. Ready? 5, 4, 3, 2, 1. Good. Same. Ready? 5, 4, 3, 2, 1. Good. Okay. Big toe. Ready? 5, 4, 3, 2, 1. Good.
Cramp.
5, 4, 3, 2, 1. Good. And then I would do reflex testing. Good. Little hyper reflexive, just a little bit.
Yeah.
Yeah. We can do Achilles. Go ahead and relax. Good. You would definitely do this with a reflex hammer. Good. I probably wouldn't do it with the other ones. Would you?
No, I wouldn't.
Maybe. Oh, but I need a hammer for that one. So we're sorry, we're not gonna do that. Hyper reflexive, normal, I would say your Achilles.
Great.
Okay, good. We're gonna do what's called the slump test. Okay. Part of it is just to test out your kind of that sensation you're getting down into your leg. Okay, and you're gonna help me do this. So you're gonna actually do it yourself. So first thing is you're gonna slump down. Good. And then you're going to extend your leg. Yep. Do you feel anything there?
A little bit like right here.
Right there. Okay. And then I would get my goni, but that looks like full knee extension with no dorsiflexion. So that was good for us to know. Okay, let's do this side. Okay, so reset ourselves. We're gonna slump down, extend. Anything there? Good. How about dorsiflexion?
It's fine.
Good. And then how about if you look up?
It's fine.
Okay, good. Okay. Okay, now I'm gonna move on to the table exam. So Dr. Harris is gonna lay down. I'm gonna do a quick hip screen. So I'm gonna bring her into full flexion. Oh wow, that's a little tight. So definitely feel more soft tissue restriction, no joint stuff as we move into that, more on the right side, so the involved side. Anything when I come up through there? Anything if I stay there?
Yeah, I start to get like a little bit into this here, but very faint.
Okay. And then let's check your rotation. That's good. How does that feel?
It's fine. My glute just feels tight.
Yeah, I agree. Feel more tissue restriction, but nothing there.
Nada.
Right? Okay. Let's go here. Same tight on that side too. Does that make you feel a little nervous going all the way through that?
No, I think I just have a hard time relaxing my leg.
Probably true. A little more limited on this side. How does that feel?
I don't feel anything with that.
And good there.
Yeah, fine there.
Okay. We're gonna just check kind of where your pelvis alignment is, okay? So I'm gonna come in on iliac crest, come all the way down, and look and see. So I would definitely say, so if we start to name it, there's an out flare on the right side, meaning pelvis is kind of rotated out this way, and possible upslip on the left. So then I'm gonna come down to your malleoli. I'm gonna give you a little tug, see if we straighten anything out. And that I agree with. You have kind of what we'd say is a shorter axis on this right side than on the left. So longer on the left. So kind of sitting out and down.
Oh,
I mean
my right side?
On the right.
My right side? Yeah, gotcha.
Your right side. Yeah, my left side. Yep. So definitely longer on this side. So I'm gonna feel where your hip flexors are. Okay, see how that feels. Any tenderness to that?
Definitely, like a little tender on this side.
Yeah, I was gonna say it feels to me more restricted on this left side, which would make sense as to why maybe everything's. Part of that could be you just putting a lot of weight on your left side. Try not to put as much weight on your right side also. Yeah. Okay, we're gonna probably check that and do another test in a little bit to really look at that. Okay. While we're here, I'm gonna have you do a bridge. Okay. So feet are flat on the mat. Good. And then you're just gonna bring your hips up as high as you can get. Little low on this right side. What's going on with the booty?
It's not
no
here.
More booty. Okay, go ahead and come back down. Any pain with that?
No, I think I just stopped myself before getting all the way there, because if I do, then it pinches in my lower back.
Okay, let's try this. So we're gonna come up again. Good, and then I'll let you start with this side. You're gonna lift this side. There you go. Good, great. Now we're gonna try this side. Oh, that was good.
I'm working.
Pilates
really
is helping. Pilates is helping. A little dippy though, still. Okay, good. Go ahead and relax. Okay, I just want to check one other thing. We kind of checked it in seated, but because we might have some hip flexor involvement, I'm going to just check some of your muscle strength in this position.
Oh,
okay. So I'm going to have you come up here. I don't want you to let me push you down. Hold strong, hold strong, hold strong. Very good. Okay, let's try this side. Hold strong, hold strong, hold strong. Really good. How does that feel?
It's fine, way easier.
Yeah, right? Right? Okay, one other thing I'm going to check is just to see, I know you've been doing Pilates, so you've been working on that draw-in. Can you do that draw-in for me? Good. Go ahead and relax. So what I'm feeling for is kind of transverse abdominals. If you come in from iliac crest about 2 fingers, meaning their fingers, not always your fingers. So just thinking about her body height. Come in, you're gonna press lightly. The draw-in, you should feel the transverse abdominals underneath. You're doing a good job. So Pilates is working. Go team. Okay, we're gonna flip you over onto your belly.
Okay.
Let me get you Actually, maybe I'll find a pillowcase for us. Good. You can lift your feet up here. What kind of dance did you do?
I did everything. So the studio and company I was with, we were required to do ballet and then point until a certain age.
Okay.
So I did that for a long time, and then I competed in contemporary and jazz and tap and
there you go.
Did some rockette type of stuff.
I'm gonna pull your shirt up a little bit, and then I'm just gonna tuck your shorts down. That's fun, rockette style.
I know.
Did you ever get to go to New York?
I did.
What?
I didn't dance, but I got to meet the rockettes. So
that's amazing.
Cool. I was like an inch too short.
Were you?
Now they accept shorter rockettes, but
I mean, you are very tall, so they must be really tall.
They're super tall.
How does that feel?
Pretty good.
Good. I'm gonna push on your spine, okay? And you just let me know how that feels, okay?
That's like tender, I would say.
Yeah.
Yeah, agey.
And does it go anywhere?
It doesn't feel like it is.
Okay. And how about here?
Oh, I can feel that in my belly.
Yeah. Feels pretty prominent in my hand. How about
here?
Same. Feel it in your belly. How about there?
Oh, definitely in my belly.
Okay. How about there?
Just in my belly, but stiff.
Okay. And how about there?
Stiff. So really stiff.
Real stiff. Like
Yes.
not moving. I'm gonna have to get a jackhammer. I just want you to know to work on this spine a little bit. Yeah, real stiff. Okay, good. Now I'm gonna go on this side. Okay. How does that feel?
It feels like it's moving.
It is.
Yeah.
Do you have any pain or any symptoms down your leg?
No.
Okay. How about that one?
I feel like it's stiff.
It is stiff. Not as bad, but still stiff.
Yeah, it almost feels like just like the muscles sore underneath almost.
Yeah.
And same there.
Yep, and I feel some definitely muscle guarding, hypertonicity in that side. So let's go to this side. How does that feel?
Definitely feel that in my belly.
You do,
Yeah.
on this right side. Okay. And how about there?
Not as much, but it just feels stiff.
Yeah, not as bad, right? And how about there?
It just feels stiff.
How about there?
That feels okay.
Yeah, like normal.
Yeah, normal.
Okay. I'm gonna push on your sacrum.
Okay.
Okay. So I'm just gonna do right in the middle first. How does that feel?
That's fine.
Okay. Anything down there? Like right in there?
That's tender.
Yep.
Yeah.
And that?
Yeah, that's a little tender. None of it's really like the same type of pain. It's just kind of tender to touch.
Just yeah. Okay, and then let's do kind of one side at a time. How does that feel?
It feels fine.
Okay. And how about this side?
Just feels stiff.
Yeah.
I'd say the closest it was to like my same low back pain was when you were like on, I think, L5.
Yeah, low.
Yeah.
Yeah. How does that feel?
It feels fine.
You move a lot better that way.
Yeah, it just feels like tight.
Yeah, it is. Let's kind of check out where that hip flexor comes in. Yep, got you.
Ugh.
Right? In there.
Ugh.
Right?
That's terrible.
Okay, let's check these guys out. So already, right? So this is what, Eli's test? So we'll see a pretty significant shift right there of Dr. Harris's sacrum and pelvis. So if I give her some stability, definitely some resistance through her anterior thigh as we come down. How does that feel?
Tight.
Yeah.
But then also like tight up here.
Like pinchy.
Yeah.
You almost get that pinchy feeling.
Yeah.
Okay, let's do this side. See kind of the same phenomenon as we come through. And how about there?
I think it's worse on this side.
Yeah, on the right.
Yeah, and I start to get some of that burning into my like tibia.
That makes sense. Okay, now let's go both.
I feel so tight in my low back with that.
It does, doesn't it?
Like I feel like it's like all like right here.
Yep, kind of this fulcrum point right here.
Yeah.
Right? Yep. Yep. Okay, good. Okay. Did I miss anything in prone?
I don't think so.
Okay, great. I'm gonna move. Okay, we're gonna do some special tests, okay? So just kind of looking at some of that, what we call is neural tensions going down your legs.
Mm-hmm.
So we're just gonna start with this leg first. I just want you to let me know if you feel anything as we move up and through it. It's good.
Yeah, it's good.
Nothing?
I got like towards the end, just through hamstring,
Just
a little
tight.
calf. But
Yeah,
not too
so
bad.
let's check your hamstring length. Ooh, okay, we might need to work on those hammies a little bit. Go back to yoga soon.
Okay, great.
Okay, so let's do this one. So you let me know when you start to feel it.
So you're right about there.
Right about there, okay, and if I were a really good PT and professor, I would have a goni, and I would measure that. So I'm thinking goni vision would say about 45 degrees. Good, okay. Does it go away when I, so totally back to kind of baseline?
Yeah.
Okay, I'm gonna just add a little bias into that, okay? So do you have anything with that?
Not right now.
Not right now, okay. I'm gonna keep that, and then we're gonna raise your leg up, and you're gonna let me know.
So right about there, I feel it in the outside of my like shin, and then across the top of my foot.
That part, okay. Okay, so less than our normal straight leg raise, so we're gonna say approximately 30 degrees for that one. Okay? Would you bias any of the other ones? I don't know that I would do that, but.
I wouldn't because of where my symptoms are.
Right, and I don't wanna keep flaring up, so. Okay, good. So we're gonna move on from those. The next one I'm gonna have you come to the edge of the table, kind of go ahead and stand up. We're gonna do what's called the modified Thomas test. So kind of check out those hip flexors and see what's going on with those. Okay, so you're gonna sit where you're almost put the table onto that position. We're gonna do this leg down first. So you're gonna bring this leg up, hold it, and then I'm gonna just lay you back. Good. Can you grab underneath your knee? Good, and really pull towards you. How does that feel?
I just feel a big old stretch.
Like all right in here, or do you feel it more down into your?
I feel it like hip flexor and even like groin, like adductors a bit too.
Like, oh yeah, that's tight right there.
Yes.
Okay. So we're gonna kind of unhook that hip flexor and then let it come down and rest there. Still feel that same thing?
Yeah.
Okay, I'm gonna just give you a little bit of stretch here while we do that.
Oh.
I know, right?
Holy moly.
Anything in your back?
No.
Good. Okay. Why don't you just lay there and we're just gonna switch legs.
Okay.
Okay, so you're just gonna lower this one down. Good, and I'm not sure if you can see that on the video, but definitely more abducted on the right side than on the left. So pretty significant abduction, and then pretty significant knee extension as well. So again, kind of telling us that her quads and probably even her lateral aspect of her leg and thigh, so IT band, that kind of stuff, can probably be contributing to what we would call almost like a double crush. Okay, I'm gonna unhook that hip flexor, come down. How does that feel? Don't feel it quite as much as that left side.
No.
Which matches what we found
right there
in our supine exam, with her left being sitting a little higher on her ilium than her right side. Okay, good. How do you feel right now?
Fine.
Okay, we're gonna do what's called the prone instability test.
Great.
Okay, so it's kind of funny. You're gonna just kind of hug the table. Okay, and then I'm gonna push on your spine. We know that was like L5 where you started to get some of those symptoms.
Sure.
So what I'm gonna do is you're gonna do that. I'm gonna ask you to lift your legs up, and I'm gonna push down on that segment, see if it's any better.
Okay.
Okay. So you're gonna go ahead and hug it. Good. I'm gonna kind of just find my hand and then press down on there. Yep. How does that feel?
That spot's okay. I think if you go a little lower.
Go a little lower.
Yeah.
Okay. Yep.
Yeah. That's it.
Okay. So now I'm going to leave my hand here. I'm going to have you hold on to this table nice and tight. And I want you to lift your legs up as high as you can get them. Yep. Is that as high as we could go?
I think so.
Okay. And then I'm going to push down. How does that feel?
That's better.
Is it better? Is it still there?
It's still there, but it's not as bad.
Okay. And how about if I push on this side?
That's better.
Okay, good. Go ahead and rest. Kind of hard to do, huh?
Yeah.
We're gonna work on that, but that's what we're gonna do. Okay. All right. So our next test that we're gonna do. Remind me what we said.
Trunk extensor.
Oh yeah, we're gonna pause the video. Then we're gonna do some muscle power testing. Okay. We're gonna do some just functional testing. Okay. We'd like to start with just a normal plank. Do you feel comfortable doing it up here?
Yeah, I think so.
Okay. Why don't you give me that?
Forearms or hands?
Forearms, please. Yep. That's good. Can you lower these hips down a little bit? A little bit more. Good. How does that feel?
Good, just hard.
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33. Okay, you can rest.
Proving a point here.
Yeah, yep. Okay, any symptoms when you're doing that?
When I got tired, I felt like I was just kind of pinching again, like kind of low back, but that was it.
Okay. Okay, this next one is kind of an interesting one. I'm gonna grab a chair for you. We're gonna look at your ability to hold your upper body into extension.
Okay.
Okay, so I'm gonna hold your legs. So you're gonna move your body to where your front of your hips is off of the chair. Off of the table. Okay, there you go.
Okay.
Good. Okay, so when you're ready, you're gonna hold yourself into extension, up a little bit higher. Good. 1, 2, 3. Any pain with that?
No, I feel like my hamstrings are working so hard right now.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26. You're doing good. 27, 28, 29, 30, 31, 32, 3, 34, 35. Okay.
Over this.
Good job. Good job. You can scoot yourself back. So technically there's a test called the Sorensen test. You're supposed to be able to do that for 4 minutes. So just something for us to work up to.
Lovely.
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 Okay, I'd love to see you in a side plank. Okay, so we're gonna do it with knees bent. Yep, to 90 degrees. There you go. Good. You're gonna stack that elbow underneath your shoulder. Good. And then we're gonna lift those hips straight up. Good. How does that feel?
Good. I mean, it just feels like a lot of work here.
Does it? Good. Okay, that's fine. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 8, 29, 30. Good. Okay, let's see the other side. Okay, you're doing great. Good, yep. Stack these guys. There you go. Good. And lift up when you're ready. 1, 2, 3, 4, 5. Is it easier on this side?
It does, but I do feel like I kind of like pinch a little bit on the, I don't know.
Okay.
It's weird.
Kind of get a little scrunchy in here.
Yeah.
Good. 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30.
I feel like I could have stayed here longer on
I
this
do
side.
too. It looks, your quality of movement looked a lot better.
Okay.
I'm just curious. I wouldn't say I use this test a lot, but I do think I want to see it in you. So
Okay.
we're going to just have you lay on your back. Good. I'm gonna, you're gonna straighten both legs out. I'm gonna lift them up, okay, for you. So I'm gonna lift them kind of up nice and high, okay? Now your sacrum's flat on the table. Now I'm gonna ask you to hold your legs up. Good. And I'm looking for your back to come up off the table. Now I want you to slowly lower your legs down. Good. That's good. That's good. So in women, you know, you should be able to get lower than 60 degrees. So you did that. It was hard,
it's really hard.
But I think those are all things that we're gonna just like keep working on as we move along. Did you feel any pain or anything down your leg when you did that?
I didn't feel anything down my leg, but I think probably as I got to like below 45, I felt like a lot of strain in my lower back.
Yeah. Well, and you started to arch at that point too, so that's good. It just kind of helps us with where we're at and some of the things we need to focus on. Good.
Great.
Okay, great. Good job, us.